Hello, my dear students. You have already know the different parts of face. Also, you know the different parts that can be seen in the palate. So, palate is divided into soft and hard palate. So, if you carefully observe face, I'll just go through different parts of space. You kindly follow the brush that is going on in the screen. So this is forehead, eyebrows, ears, the nose or nostrils, external nose. The openings are called as nostrils, and the depressed part just below the nasal cavity. So this part is called as philtrum. Then you got the upper lip, the lower lip, and this is the jaw, lower jaw. So this bone that you find in the upper jaw is maxilla, and this bone that is present in the lower jaw is called as mandible. So we'll follow once again: forehead, maxilla bone, and mandibular bone. So three major things that form the face are the forehead, the maxilla, mandible. Similar to this gross features, you can see the face develops from three sources or three processors or swellings that is present around the primitive mouth. That is number one, frontonasal process. Frontonasal process. Number two, maxillary process. There are pairs of maxillary process. Number three, mandibular process. Mandibular process. So to be more clearer, you should know that development of face is by five things or five swellings or five processes. So that is formed around the primitive mouth. It is also called as stomodium. So which are the five processes? We'll know. You got number one, frontonasal process. It is only one. There are two maxillary processes, that is they are paired right and left, and two mandibular process, paired mandibular process. So two mandibular process, two maxillary process, and one frontonasal process. So face develops from these things. So if you carefully observe the diagram, you can see the frontonasal process. It develops into forehead, the external nose, nasal cavity, and the nasal septum. Also the philtrum of upper lip. So these are the structures which are derived from frontonasal process of. Next we'll go to maxillary process. From the maxillary process, you'll get the upper part of chin, upper part of the cheek, and the lower part of the cheek. Also the lateral parts of the lips. So these are the structures which are derived from maxillary process. I'll repeat again. The maxillary process give rise to, or the part of face which are derived from maxillary process are upper and lower part of the cheek and the upper part of the lips. Clear? Fine. Next we'll see what happens to the mandibular process. The mandibular process gives rise to the lower part of the lip, that is the lower lip, and also to the lower part of the cheek, that is around the lower jaw. So that gives rise to what is called as mandibular process. So is it clear now? Yes, we'll follow this. Frontonasal give rise to forehead, this part, the external nose, nasal cavity, nasal septum, and philtrum. Maxillary process give rise to upper part of the cheek, and also the mandibular process give rise to lower part of the cheek and also to that of the lower part of the lips, lower lip. So this is how the structures or the processes develops into face. Usually at the end of fourth week, These five swellings appear around the primitive mouth. What is the name of primitive mouth? It is also called as stomodium. Primitive mouth is called as stomodium. Primitive mouth. The five facial primordia consist mainly of mesenchyme derived from neural crest cells, which are covered by ectoderm. They are covered by ectoderm. So we'll see the things from which these face will develop. So this is a diagram where you can see different parts. So we'll go again. The part which is yellow in color, it is frontonasal. In diagram A, we'll go to this in detail. So you can follow the brush. The part which is yellow in color, so that forms the frontonasal process. It forms a frontonasal process. The part which is green in color, that is maxillary process, and the part which is sky blue in color, that is mandibular process. So this is the primitive mouth. It is also called as stomodium. Small placodes are present. One is a lens olfactory placode, which is medially placed. The other placode is lens placode. So yellow color represents frontonasal process, green represents maxillary process, blue represents mandibular process. So next we'll see what happens to our other processes in the diagram. So this, the nasal placode or the olfactory nasal placode gets divided into two swellings, that is the lateral nasal process and medial nasal process. The lateral is colored in pink and medial nasal process is colored in orange. At the center of this is the nasal pit. So you got the nasal pit. So that is these swellings, they develop around the nasal placode or nasal pit. So later what happens? So it forms a different eyes are formed from the lens placode. So what happens is the medial and the lateral nasal processes starts fusing each other. So you can see here, so it starts fusing each other. So they starts fusing with that of maxillary process. So the extended part of this will fuse with that of maxillary process. The medial nasal process joins together to form the joins with the maxillary process here. The fusion of maxillary process with medial nasal process. Then later what happens? There is a fusion of maxillary process with lateral nasal process. So this narrows down the mouth, which in turn causes fusion of maxillary and mandibular process, which forms the cheek. Is it clear? Fine. The eyes, the developing eyes are here. You can see here, and you can see the fusion of maxillary and mandibular process. You can see fusion of lateral nasal process, medial nasal process with that of maxillary process. Fusion of, this is a line of fusion of lateral nasal process with a maxillary process. This dotted lines represents fusion of right and left mandibular processes. So this is how the development of face, various stages in development of face that can be seen. So we'll just go through the development of, this is the lips, the upper lip, the lower lip. The upper lip in the center, above that you got the philtrum. So which I had already told you, frontonasal process. It develops from frontonasal process. The lateral part of upper lip, it is derived from maxillary process. So this is how the different parts of the lip develops. The lower lip develops from mandibular process. Mandibular process. But here there is a thing, only this inner part develops from the frontonasal process. Now we'll see how the skin overlying the lateral part of the lip will overgrow the frontonasal process. Can you see here? See the arrow here? So this is the yellow color is the skin. It grows over the frontonasal process to form the skin over the philtrum. To form the skin over the philtrum. So this is the diagram which shows how skin covering the maxillary process overgrows. That can be seen. So now we'll just look at the different parts. So this part, the part which is yellow in color, this part is derived from ophthalmic nerve. It is supplied by ophthalmic nerve. The part which is green in color, it is supplied by or derived from maxillary process. So it is supplied by maxillary nerve. And the area from the mandibular process is supplied by mandibular nerve, which is colored blue. Clear? So this is about the embryological basis of sensory nerve supply to the face. Now again we'll go to different parts. Our forehead, it develops from frontonasal process. Now supply ophthalmic division of trigeminal nerve. The nose develops from frontonasal process. Now supply ophthalmic division of trigeminal nerve. The cheek upper part, maxillary process. Maxillary division of trigeminal nerve. The lower part develops from mandibular process. Mandibular division of fifth cranial nerve. The upper part, fusion of maxillary process of two sides with the frontonasal process. Again it is supplied by maxillary nerve. The lower lip, it is formed by fusion of mandibular process of right and left side. The nerve supplies mandibular nerve. But this is how things occur. Now we will just go to how does the nasolacrimal duct develops. You can see carefully in this, a part which is yellow in color is part of frontonasal process, which has got two processes, lateral nasal process and medial nasal process. In between it has got nasal pits which are opening into the stomodium. This lateral nasal process, you can see solid ectodermal cords which extends from the eyes, developing eye, to that of the nasal pit that is opening into the. So this dotted line represents the formation of nasolacrimal duct. So this is how the nasolacrimal duct develops. Now we'll see how does the external nose develop from 5 processes. The frontonasal forms the bridge of the nose. This is called nasal bridge. The two fused medial nasal processes forms the tip and also the dorsum on tip of the nose. The two lateral nasal processes and sides, it is formed by the lateral nasal processes. We'll repeat. This is what a bridge of nose, frontonasal process, fused medial nasal process. It is from dorsum and from the dorsum and tip of nose. Lateral nasal processes form sides and ala of the nose. So this is how the external nose develops from 5 facial processes that can be seen. So this diagram, you can see different parts of external nose and from which it develops. Now we'll see the formation of nasal septum. This is the other view, frontonasal process that you can see here, and this is the developing tongue, and the green colored part is maxillary process, and here you can see the developing eye. So this is frontonasal process. So later what happens? So this give rise to the palate. So this is what you can see clearly. This is the tongue with that of olfactory bulbs that you can see. So this is how slowly there is formation of palate, fusion of palatal shelf of the frontonasal process forms the nasal septum, or the lateral to that is the nasal cavity. There is connection between eyes and with that of the nasal cavity, which forms nasolacrimal duct. So these are the different stages in formation of nasal septum and shelves. Now we'll again go back to this. Dorsum and the tip of nose, frontonasal process. The nasal cavity is developed from nasal sac formed by elongation of nasal pits. Nasal septum is again formed by frontonasal process. Nostrils, nasal pits. Choana are also called as posterior nares. It is formed during after the rupture of oronasal membrane in the second month. This is the development of various components of nose and the source of development. Now we'll see intermaxillary segment and maxillary process. The one which is here orange color, that is intermaxillary segment, and the part which is yellow in color, that is maxillary process. So intermaxillary segment give rise to premaxilla or primitive palate, and from this you can see the palatal shelf which go and fuse on to right and left side. So primary palate, and this is the palatal shelf that you can see. So from this incisors they develop from this intermaxillary segment, or it also gives rise to philtrum, maxillary bone, and also the triangular primary palate, intermaxillary segment and maxillary process. So this is how it appears, the palate. The anterior part becomes ossified to form hard palate, and the posterior part is soft palate. It doesn't gets ossified. So hard palate with soft palate forms the secondary palate, and that intermaxillary process which forms a triangular shaped anterior part of the palate, that is called as primitive palate. So this is how things go. Now we'll see development of various components of adult palate. As I said before, there are two palates, hard palate and soft palate. Hard palate, you got bone within it, so it is called hard. Soft palate, there is no bone, it is made up of mainly of muscles covered by mucous membrane. Now we'll see hard palate. So we got a premaxilla that is formed by the fused medial nasal process of frontonasal process. Behind the incisive fossa, it is formed by fusion of palatal shelves. Soft palate is formed by unossified part of fused palatine shelves. So that is how things go. So this was all about development of palate. So palate develops from, or it has got two parts, hard, soft palate. Hard palate has got different development. Later it gets ossified to form bone within it. Soft palate doesn't form or gets ossified, and only it is made up of muscles within it. This is the condition which usually can be seen soon after birth. That is cleft lip. This is the upper lip, there is a cleft in the lip. The mouth which is has a cleft in it. So unilateral cleft lip, upper cleft. You can see the cleft is on both sides. So it is bilateral cleft lip of upper lip. Here it is in the center. So median upper lip, cleft of the upper lip, hair lip. Then this is lower cleft lip. So these are the different anomalies, facial anomalies that develop due to non-fusion of different these five processes of that helps in the formation of face. So this is one more thing where oblique facial cleft, that is the importance. Now we'll see what are the cleft palate that you can see. So this is premaxilla. When it fails to fuse with that of the secondary primary or secondary maxilla. So this is unilateral. The cleft lip extends, cleft palate extends, also extends up to this. So that is unilateral cleft lip. This is bilateral complete cleft palate. So you got two things, cleft lip, cleft palate. So if there is a cleft in the lips, it is called as cleft lip. If there is developmental fusion anomaly in the palate, it is called as cleft palate. So now we can see different incomplete partial cleft palates here. So this is called, it is not complete, it is only the uvula, the posteriormost part is not fused. The cleft of the soft palate involving uvula and adjoining part of soft palate. A cleft of the soft palate extending into hard palate. So these are the different or incomplete or partial cleft palate that you have to see. So this is how exactly it appears. Congenital anomalies of cleft lip and cleft palate. The first diagram shows an infant with unilateral cleft lip and cleft palate. So can you see here, this is on the right side, it is only on one side, unilateral cleft lip with cleft palate. In this you can see that it is bilateral, both on right side and left side. So these are the different congenital anomalies of cleft lip and cleft palate. So these can be corrected with surgeries, and person with can live normal life even though there can be some difficulty in speech, and which can also be corrected by speech therapy. That's all for now. Stay safe. Thank you, one and all. If you have any questions, kindly send in the comment section of the classroom. Thank you, one and all.